Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. We talked and re-recorded a very popular podcast episode called Vagina One-on-One, How to Care for Down There. And I just walked out and I said, we talk about the vagina quite a bit in our in our clinic. Rightly so, right? But I was curious because I don't know much about the male anatomy. So I told my staff, I was like, we should reach out to one of our governing board members, Dr. Hervey, and see if he could come in, give us some insight about the male anatomy and how to care down there. It's always good to talk about female and male anatomy, and because we talk about reproductive health and that fits in with it. And so we have in the studio our dear governing board member who's been with us for a while, Dr. Hervey. Hi, Hervey.
Hi, Helen.
How are you today?
I'm fine.
Awesome.
It's a beautiful day and
yeah,
I'm good.
Awesome.
Yeah.
Awesome.
I'm happy to be here.
Thank you. Thank you for being here. Yeah. Could you give us a quick, your background?
Oh, of course.
Yes.
So I'm a recently retired pediatrician, which means after my medical school, I did extra training in pediatrics. And then I worked for 40 years.
Wow.
Different clinics, different cities, different offices, and now I'm retired.
And retirement looks really good on you.
Well, thank you. It feels good.
It feels good.
I love pediatrics.
Yeah, what drew you to that field?
Oh, I like talking with kids.
Yeah.
And I enjoy giving families information. Helps them raise their children, helps children develop and flourish. Really, that's the goal, pediatrics.
Yeah.
Flourishing in health, mind, body, and soul. Yep.
Yeah. I think you were made to be in pediatrics because your voice is so calming and your demeanor is always so chill. If I had to bring my son in to get like a vaccine or something, I would have loved you to give that to him because you probably be like, it's okay.
Yeah, I said that a lot.
Okay.
I said that a lot.
It's okay.
Yeah, my voice, it's pretty recognizable. I would call people on scheduled phone calls and they'd say, oh yeah, of course I know it's you. I recognize your voice.
Oh, yeah.
So
it is really recognizable. Yeah. But it's also very calming, which I appreciate, which is why I said I think you're made for pediatrics. So your patients must be really missing you.
It was sad
for
me and them separating. I hired someone to take my place and she's doing a great job. So I'm happy about that.
Yeah.
Now I'm trying to be useful and have fun.
Yeah. And spend more time with your wife, right?
Of course.
Yeah.
Of course.
Yeah. And pediatrics usually range from what age to what age, Hervey?
So we're there at birth for some complicated deliveries.
Okay.
Or we see babies in the hospital right after birth.
Okay.
Before they go home.
Okay.
And pediatricians are the specialty pediatricians who do neonatal intensive care. And then we take care of kids till they're teens. And then it varies a lot depending on the family and life circumstances, whether they switch over to family medicine or internal medicine when they turn 18.
Okay.
Or 20.
Okay. So you can see a pediatrician until age 19 or 20.
Generally.
Okay.
We cut them off at 21. And the funniest story I have of that is a guy who came in, he's a classic lumberjack.
Okay.
Plaid shirt, broad shoulders, heavy beard,
Yeah.
more muscular than me. And I said, you know what, son? It's time for you to switch. No, please. He did.
Oh, you get used to you get used to going to one person all your life. And
right.
that change is pretty daunting sometimes, right?
A little bit.
Yeah. I remember seeing my pediatrician till as long as I could.
Yeah.
And then there was one time where she's like, okay,
right.
Your issues are beyond me now. You need to go. It's like, no, okay.
Yeah.
Well, anyways, I'm so glad to have you here. We're going to talk about male anatomy and how to care for down there. I'm going to bring up some questions I have myself, but also, why do you think, from your point of view, why do you think our audience should hear about this topic?
Great question. And I would respond by saying, who is your audience? So I suspect many of the listeners are women. Mm-hmm. So this is for them, but it's also for the men in their life.
Yeah.
So they should pass this on to the men in their life as well. Why in general? Because it's part of our bodies. Mm-hmm. It's an important part.
Yeah, it's reproductive health. It falls under reproductive health.
Certainly.
And, we have predominantly women listeners, but they also have sons. They also have
That's right.
boys in their families that they could pass on this information. So I find that fascinating. Just to start off with a basic question, what is normal male anatomy? How would you define that?
It's pretty straightforward. If you look on the outside, you can see everything that's just there. Mm-hmm. There's the penis covered with a foreskin at birth. Mm-hmm. And then if a person is circumcised, then you can see the head of the penis. Mm-hmm. That's the glands. And the rim is called the corona.
Okay.
Then there's the shaft of the penis, the length of it, connects to the body just above the scrotum. Mm-hmm. Then you look, and of course the scrotum is the sacs for the testicles, one on each side, but they're really one sac.
Okay.
And then if you look inside, you see the testicles and the various glands associated with those. Mm-hmm. Then the prostate gland is overlapping the urethra. Mm-hmm. That's the external canal that urine and semen go through. And then on the very outside, the tip of the penis, you see the urethral opening called the meatus. Oh. meatus. The hole.
Wow.
That the stuff comes through. Yeah.
I didn't even know there was a name for it.
There's a name for everything. Oh, yeah.
So fascinating. So fascinating. It's just fascinating from a female point of view of like, our genitalia are kind of inside of
hidden.
us. Yes. Right. And then, the male.
It's just all
out there.
Exactly.
Like, I always wondered, like, how do you guys walk around? Like, doesn't it get in the way, But you touched on circumcision. So what is circumcision? When should it happen if parents decide to circumcise their sons? And what's the process looking like? I knew, having a son myself, that process was a whole thing. Like my husband and I had to sit down and be like, okay, what do we want to do? Right. Because it doesn't happen in the hospital anymore.
That's true.
Correct?
That's
so
correct.
Could you kind of walk us through that and why parents should consider or not consider circumcision?
Sure. So there's a couple different decision points. Like you say, the first one is at birth. Mm-hmm. Or after birth. Mm-hmm. So the statistics, the studies show there's not really any reason to have a circumcision for medical purposes in the first few years of life.
Okay.
So then you will ask, well, why would I have one then? So then it goes back to social, cultural issues, reasons.
Okay.
And that's dependent on the family and the society they live in. Mm-hmm. Some societies, very high circumcision rate, Jewish societies in Israel, Muslim societies. Some very low, it's the actual opposite end of the spectrum, like the Northern European countries, Finland, Europe, Sweden, so forth. So you eliminate the medical reasons, and then it becomes a personal decision for the family.
So the stereotype that I've heard of why you should move forward with the circumcision for your son is because it's cleaner. And it's easier for them to clean as they get older. Is that true or not true?
It's almost true.
Okay.
So you do, with a uncircumcised penis, to clean after a certain age, and I'll get into that in a second.
Sure.
You need to pull back the foreskin, soap and water in the shower lightly, and then let the foreskin go back in place. So the foreskin is, of course, it's like a long sleeve shirt cuff. hanging off the end of one's fist is the way to visualize it.
Okay.
And to be circumcised is to cut the cuff of the sleeve at the wrist.
Okay.
And then you see the whole fist.
Okay.
So that's a good way to visualize what is a circumcision.
So it's like tailoring.
It is tailoring. It's totally.
It's tailoring a shirt.
Yes.
Okay.
Uncircumcised, after it naturally will retract, and that takes time at birth, it doesn't retract. You can't pull it back without causing injury. So you just let it sit for a few years. And then around 5 or 6, it becomes more flex retractable. And then at that point, you teach a child to pull it back slightly, clean in the bathtub, and then let it go back.
But there's no increase of bacteria that could be in there if not kept well clean.
No. The normal bacteria that lives on the skin is different in different parts of the body.
Okay.
So the ones that are resident there are not harmful.
Okay. All right.
You will have excess dead skin build up.
Okay.
Think of it like earwax. It's whitish, and it looks like, sometimes it can look like cottage cheese, but it's just dead skin.
And you said there's no medical need to circumcise.
In the U.S., there isn't. In African countries where there's a higher rate of heterosexual HIV, it's an indication to get a circumcision for adult men. Okay.
So what's the oldest age that someone could move forward with a circumcision? Or is there any age limit?
Oh, there's no age limit.
Oh, there's no age limit.
Yeah. See if there's no age limit.
Okay.
It's simplest in the newborn period because the anesthesia is really short and just local. But later on, they tend to do more general anesthesia, and it's a little more complicated. But there are indications for it later in life. There are conditions where the foreskin gets stuck.
Oh.
Or you have increased recurring infections that are bacterial.
Okay. Is that area more sensitive once you get the circumcision or less sensitive?
Oh, there's debate about that. The only way to examine that is to do a survey of men who have been sexually active before circumcision and then after.
And there's no study like that yet?
There are studies like that.
Oh, there are?
Oh, yeah.
Okay.
There's even a lobbying group that says against circumcision in adult men. Yeah.
Oh, yeah. I've heard of those.
Yes, right. So, you know.
Well, moving on to the next question I had was, what is necessary to wash male genitalia area and why? Should you wash it daily? Because my hair, I've been told, don't wash it every day because it's like bad to wash it every day. I wash it every day anyways, but should you wash your genitalia every day?
Generally is yes. 2 reasons. One is discomfort, and the second would be the smell. So you have a lot of sweat glands in your groin area, and if you don't wash them, eventually it'll start to be noticeable to other people.
Okay.
So the same frequency you get showers, and soap and waters is fine. Doesn't need anything special.
So there's not anything like, they advertise a lot of intense smelling deodorant or intense smelling body wash for men.
Oh, yeah.
Is that something you would not recommend?
That's strictly cosmetic.
Okay.
As long as it doesn't damage your skin.
Okay.
It's up to you.
Okay.
Whether you do it or not. There are some conditions where people sweat excessively, not just during exercise, but all the time. And it may be their palms, it may be under their arms, it may be all over, it may be their groin area. So in that case, using a antiperspirant in the groin area is effective.
Is that like a spray?
Same kind you'd use under your arms.
Oh, okay.
Yeah, any brand, as long as it doesn't cause skin irritation.
Okay.
It's okay.
I know for women, we're so worried about smelling a certain way. And do you think that men genitalia have a certain smell as well?
Well, everyone has a body odor. And there's some differences between, different cultures, different eating habits that can affect your sweat. Yeah, again, it's a question of what are you worried about and what do you want to smell like?
Yeah. Do you think men worry about the way they smell more than women?
It depends on the man.
I feel like we get a lot of women coming in wanting to mask their smells.
Yes.
wanting to, because, we have our periods and that comes with a certain smell. And, it varies in different times of the month. So, but, I feel like a lot of our patients come in and they want to like oils up there or crystals up there or, to mask this natural odor. We don't get a lot of men. Now, we don't get a lot of men patients, period. But when we do, that's never a concern of theirs.
No, I don't think it is generally because it's their level of hygiene in general is the issue.
Okay.
If you have someone who is not so careful about their hygiene in general, they're going to stink more in their genital area and they'll have more rashes. We should talk about rashes.
Okay, let's talk about rashes.
So jock itch is number one.
Okay.
It's fungal infection. It's the same thing, same kind of germs that cause athlete's foot. And it's the same treatment with a fungal powder or ointment.
Okay.
And cleaning the area, keeping it drying out. And the cause is usually because constant moisture. So the yeast that cause it live on our skin. It's part of our natural biome where we have a mix of yeast and bacteria. So if they are allowed to thrive in moist conditions, like someone wears a bathing suit that's wet for 2 days in a row, 3 days in a row, they're going to get a yeast infection, pretty likely.
We recommend our female patients, like after a shower, like on a low, using a blow dryer, like on low, just like not directly on, but kind of away, but kind of blow drying that area. Would you recommend that for male patients?
Most of the time, not necessary.
Okay, just air dry?
Just air dry, towel dry, and air dry.
Okay. Yeah. How long does a jock itch last?
Oh, well, it depends how you treat it.
Okay. Okay.
It's a little slow to develop. Yeast grows slowly compared to bacterial infection, and sometimes decreases slowly. So, but usually the itching and the redness will calm down within a day. It'll still be visible, but not quite as irritating.
Is that something someone could identify and just be treated over the counter, or would you recommend them coming in to a place like 3W, get checked out, and say, "Yep, that's a rash. You should do XYZ now"?
Normally, it can be self-diagnosed.
How about grooming? We have a lot of female patients that come in and ask us questions concerning grooming purposes, and in the sense of, should they completely shave down there if there was any type of rash or itchiness or something like that? Should they wax? Should they pluck? Should they shave? Should they all of that stuff?
Right.
What for the male anatomy, what is your recommendation for grooming?
So I had to look into this a little.
Okay.
Now I have a visual picture for folks.
Okay.
Okay. Think of James Bond. Okay. And all the actors who've done James Bond. Sean Connery, full chest and back of hair. In his movies. Okay. The latest versions of James Bond. Daniel Craig, completely waxed. He's like hairless. Yes. From the chest up. Huh. That's a cultural change. That's a social change. So that's a question of not only cosmetic but it's a fashion question.
Or preference?
And a preference, fashion preference, right.
Okay.
Right. So medically, unless you cause yourself problems, it's not an issue. You can groom to the level you want. There's even a term for it, it's called manscaping. Yes. Yeah. Yes. Yeah. Landscaping the yard. It's pretty funny. As soon as you start looking at this, and I'm gonna give you a couple of websites. Yeah. To check, people can check out. I mean, the euphemisms are hilarious.
I'm sure. Yeah. So
how to take care of down there is an example of one. It's like, so generally the same methods are available: plucking, waxing, shaving. Same duration of effect. Waxing would be the longest, and shaving lasts the same as plucking, essentially. For the female genitalia, it's a lot more sensitive, would you say? To like when we go, I've never done it before, but like waxing the female genitalia, I feel like it's a lot more sensitive to that versus if for a man to go get that area waxed, because it's always kind of outside already. Yeah, hard to say. Hard to say. It would hurt. It'll hurt.
Yeah, I'm sure. I'm sure. I'm just wondering what degree compared to.
I have no idea.
You don't know. I don't either. Yeah. Okay. So there are no health benefits for.
No, there's no health benefits. Health concerns would be if you use the same razor on your face and your genital area, you're going to transfer. If you use your genital area first, you're going to transfer germs to your face, get folliculitis, which is a irritation of the skin follicles, infection sometimes.
Okay. Ingrown hair?
Ingrown hairs can happen.
Oh, right. Well, thank you, Dr. Hervey. So we were just finishing talking about shaving, and it sounds very similar to the same advice we would give to a female patient that has questions about how to groom down there. You touched on rashes. What about STIs? How do male patients that come in, do STIs show up differently on their genitalia versus female patients and their anatomy? How if they're like, is that chlamydia, gonorrhea, does that show up differently on male genitalia?
Yes, it does.
Okay.
There's some differences. So the first difference would be it's easier to see. Like a herpes ulcer is going to be right there on the surface of the penis. Okay. Sometimes on the scrotum, but almost always on the penis. Secondary syphilis, you can have ulcers. Primary syphilis, not so much. That's more of a chronic condition. And then the other STIs, chlamydia is typically symptomatic in men. Okay. With burning on urination. Okay. Which is one of the differences between men and women, where it's much higher asymptomatic in women. And that's what leads to the infertility, secondary effects of it. So that's why partner treatment frequently starts with the man coming in being symptomatic and then treating his partner because she's not symptomatic. And then syphilis also and gonorrhea, burning with urination. Yeah, HPV can have ulcers, but they're not going to be as frequent as herpes.
And you can't test men for HPV.
No. Okay. They should be immunized. There's a standard. They're on the same immunization recommendations as women because they are a vector for transmission of HPV. Okay. Do you know, you might not know the answer, but maybe you do. Do you know why we can't test men for HPV? Just because you'd have to have an ulcer. And specifically, it has to do with the type of skin, this type of cells that it prefers. So it loves the cervix. Yes. Okay. That's where HPV resides. Yes. It's not as friendly to epithelial skin like the surface of the penis.
Male patients can have HPV.
Totally,
they can totally have it.
Of course.
We just can't conclusively diagnose it.
Not in your regular labs available. Okay. On a research basis, of course, but it's not a generally done test.
And where else can HPV be detected these days? Not just the cervix.
No, it can be in the mouth and throat from oral sex. Okay. It's true. Men or women.
If it's in a man's throat or mouth, can that be then detected as, is there a test for men for that? Or does it just come up as an ulcer or?
Great question. Not sure I know the answer.
That's okay.
So generally the tests that are done are site specific. So even though the test could be done, the same swab and send it to under the same test, unless it's been studied and licensed for oral use, it's not going to be considered a valid test.
Okay. So it sounds like HPV likes dark, moist areas.
Right. Yeah,
that's where they thrive the most. Totally, it sounds like because Okay. Very interesting. So what's your recommendation for a healthy way to approach how to clean down there for our male listeners or female listeners, actually, to pass on the information? What's something you want to leave our listeners, some last advice or tips?
Oh, yeah. So what I said earlier, soap and water are fine.
Okay.
Any kind of scents or deodorants is up to the individual man.
Mm-hmm.
Just be sure it doesn't cause irritation.
Mm-hmm.
Some men will need extra antiperspirant down there. They can use the same kind they use under their arms.
Okay.
And then as far as clothing, really the only thing, cotton's best.
Mm-hmm.
Boxers provide the most airflow.
Mm-hmm.
And that's how to keep from sweating too much and maintain hygiene.
Okay. Awesome. Well, thank you. Thank you so much.
You're welcome.
It's so interesting to talk about the other anatomy, because we talk about the female anatomy quite a bit.
Right.
So we're like, oh gosh, we're due time to talk about the male anatomy, because again, it falls under reproductive health. We do see male patients here for STI services, and our medical providers are very comfortable seeing male patients. So if you ever have any questions, if you have any follow-up questions for Hervey, please send us an email or come in and get checked out by one of our medical providers. We're always up for learning more ourselves about different approaches, but also, if you're itchy or have any questions about STIs from a male perspective, we'd love for you to book an appointment and come in and see us. So thank you so much, Hervey, for joining us today.
Well, thank you for having me.
Yeah.
It's a pleasure to be here.
Yeah. I'm sure we'll have you on for other topics now.
I'd be happy to.
Okay. Awesome. Well, thank you, listeners. We'll see you in a couple of weeks. Bye. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening. And until next time, stay healthy and be well.